Hi, my name's Mikaeya Kalantari, and I'm a pediatric dentist and mom of two.
The AutoBrush for Kids allows you to customize your brushing settings. The blue light allows for deeper sanitization, and the red light can help decrease inflammation, while the purple light combines the two. Next, choose your timing mode: green for 30 seconds, blue for 60 seconds, and red for 60 seconds without music. You can then customize your cleaning setting: green for regular care, blue for deep cleaning, and red for tissue massage. When you have chosen your brushing settings and your child is ready to brush, simply apply toothpaste to the front and back of the mouthpiece and have your child bite into the mouthpiece and press the start button. For the most effective brushing, have your child move the base and the mouthpiece side to side and up and down throughout the duration of brushing. The new AutoBrush for Kids features a set of sturdy silicone bristles with more of an inward angulation, allowing better contact with the tooth surfaces, allowing for more effective cleaning. As compared to traditional nylon bristles, the silicone bristles are also less prone to harbor bacteria.
Okay, so what's my overall opinion as a pediatric dentist with the AutoBrush for Kids? Here it is. I think that this is really a great toothbrush for some children, whereas for others, this may not be the route that you want to take. And let me explain. For those kids that are already doing a great job brushing, whether it's with a regular manual toothbrush or an electric toothbrush, keep going down that route. I feel that the most superior clean that you can get, and research has even shown the most superior clean that you can get is with an electric toothbrush, using it for 2 minutes. Now, I will tell you, as a pediatric dentist, I hear from parents every single day that tell me brushing their children's teeth is an all-out battle every time. And you know, there's parents that say, I have to hold them down to brush. They're screaming, they're fighting, or they get to that age where I can no longer physically hold them down to brush, and they just don't do it. They can get consequences. They can get restrictions, things taken away, and they still don't want to do it. So for those kids, if using the AutoBrush is going to be fun and exciting and motivating for them, absolutely. I say that this is so much better than doing nothing. The improved version actually does a really, really good job of removing plaque and food from the teeth. It is not perfect, but it is what I call a gateway toothbrush, okay? And what that means is, if you can get that into the routine for your child on a regular basis, 2 to 3 times a day, and they see that they have the time and they have the motivation, and then they start feeling good about keeping their teeth clean, then later on, once you've been using this consistently, you can then upgrade to using the electric or the manual toothbrush. This is a really great toothbrush to get your kids on the routine of oral care. Again, it makes it fun, it makes it exciting, it's a novelty factor, and it's, again, so much better than doing nothing. What I had explained before, the angle of the bristles and the more powerful vibrations are really, really going to go far into getting the teeth clean, and so much better, again, than skipping brushing altogether. So not only is this toothbrush great for kids that really have a hard time getting their teeth brushed and needing that motivation, it's also great, in my opinion, for 2 other reasons. One, in kids that have braces, oral appliances, this is something that you can put in the backpack, send them to school with. That way they can get that extra brush in the middle of the day, which is super, super important when you have retainers and appliances in that harbor food and plaque very, very easily. A quick brush after lunchtime can really, really go far in promoting better oral health. And then the next category of kids that could greatly benefit from this is those with special needs. Oftentimes, kids with special needs have a lot of oral sensitivities, and brushing in their mouth can be very, very hard, even when parents are receptive to really helping and helping to hold the child so that they can get a good brush in, it's still very difficult. Most kids that we have seen with special needs actually tolerate this mouthpiece brushing quite well. The mouthpiece, if it gets in the right spot, can really, again, clean their teeth without having to have too much sensitivity as a whole on the mouth and on the gum tissue. This can also add that massage, that gingival massage as I showed you in one of the settings. This is going to really help those kids with special needs that have any sort of gum tissue inflammation. And that gingival massage can really help to promote better gum tissue health.
Just like any other toothbrush, the AutoBrush will not replace flossing, so be sure whether it's by flossing pick or traditional floss that you floss every day.
Okay, so my final thoughts. I really think that this is a great brush for those kids that are not getting good brushing done right now. As technology evolves, I feel that you will find toothbrushing devices like this more and more. It is really an innovative concept. I think that the formulations will continue to get better and better and more improved. But again, I feel that this is a good, what I would call gateway to toothbrushing for the kids that really need that motivation and really need that encouragement and need something to make it fun. How I utilize it in my own home, to be 100% honest, is I have my girls use it in the morning brushing, because morning time for us is the hardest time. We are running around like crazy people trying to get out the door to school and to work. And previously, before the AutoBrush, sometimes brushing happened and sometimes it didn't. Terrible to say for a dental family, I know, but it's true. And since the AutoBrush, my girls are able to independently go brush their teeth on their own, and I can feel good that we've really gotten a lot of that overnight bacteria out of the mouth. Now in the evening, I do tell them, no, you have to use your regular electric toothbrush at nighttime, and we do a really detailed job with that. Then you throw in the flossing, and that is, really what our oral care routine is at home. As they get older, I am definitely going to consider sending this in the backpack to school to do lunchtime brushing, especially if they end up in braces, which is highly possible. And again, I just think that that's kind of where this brush fits into the daily routine of children. I do think, again, absolutely something to look into for kids with special needs and kids that have any sort of retainers, braces, oral appliances in. But again, to be 100% honest, if your child is already super on board with brushing and they're doing a good job and they are very low risk for cavities, I wouldn't go this route. I would stay on the routine that you've already built and feel proud of yourself for having that routine down pat. Thank you to AutoBrush for, getting another option out there. It's always great for parents to have options, and at the end of the day, you always just have to see what works best for your child and your family. And I'm glad that AutoBrush has come up with an alternative to the WrestleMania toothbrushing routine that some families experience.